Stay. Okay, so in my med room, first I will check my MAR. So I need 200 milligrams of ciprofloxacin for Skylar Shockman. No known allergies. We'll be giving it at 1300 via IV piggyback. So, get my med out here. So performing my dosage calc, the doctor ordered it over 60 minutes, so to give Skylar the 100 milliliters with his 200 milligrams, we would be giving 100 milliliters per hour. Ciprofloxacin, doing my second med check, my med is 200 milligrams in 100 milliliters for Skylar Shockman, no known allergies, giving at 1300 via IV piggyback, and it expires in 2026. Checking for color and clarity of my medication, and then grabbing my supplies that I need. Going into Skylar's room. Hi there, I'm Nurse Josette. I'm going to be taking care of you today. Can you verify your name and date of birth for me?
Skylar Shockman, 4/13/93.
Perfect. And do you have any allergies, Skylar?
I do not.
Perfect. Okay, so doing my third med check in the room with Skylar here, ciprofloxacin. I will be giving over an hour, 200 milligrams in 100 milliliters at 1300, and I'm giving it via IV piggyback. So, take out my secondary tubing here. I would attach my clamp, hang my second piggy bag after lowering my first IV pump, and then this would be spiked into the bag. Wash my hands. Clean gloves. Insert my secondary tubing. Okay. Perfect. Check with my patient, make sure that he doesn't have any questions or any concerns with my procedure. Verify everything is looking good and he is safe. The room looks safe, and I would leave the room. So then going on to my second procedure. Take this off. Okay, so then going into the catheter dressing change. Oops. So first I would get all the supplies that I need. I'm gonna put on my mask and then also have my patient put on a mask. So we're gonna do a dressing change today of your PICC line here on your arm. So I'm just gonna have you put on a mask before we get started to make sure that the least amount of bacteria possible gets in there. Perfect. Awesome. Okay, so then I would wash my hands, let that dry, don clean gloves, and I'm going to palpate the site. Do you have any tenderness with it? Perfect. It doesn't look swollen to me, so I'm going to go ahead and start removing this. I would pull towards the insertion site. Perfect. Palpating, making sure that everything looks good, nothing looks infected. The line looks the same as the document from the last nurse. It doesn't look like it's moved at all. So that looks good. I'm going to wash my hands again. Okay. So, pulling the pack away from me. Glove on. All right. So first I'm going to use an alcohol pad just to get any dry blood off. Perfect. There we go. Perfect. And then I don't have a transdermal dressing, so I am just going to pretend. First I'll put on my skin prep. And then I will use this as my patch. So I peel it off, I put the triangle towards me, and then peel off the remainder. And then tape if needed, maybe. Okay, well, we won't tape it, but that's everything.